I'm going to try and demonstrate to you the actual mechanism of how you prep the pen, which is the medication that you're going to be using, and try and demonstrate virtually what that looks like. What I want you to know is that when you sign up to the program, you will have the opportunity to see a practitioner in a physical face-to-face location who will go through this with you as well. So the things you're going to have to look out for are the pen. So the medication is literally a pen. And if you take the lid off the pen, what you have inside it with the liquid is the medication itself. So what I'm going to try and do now is try and give you a demonstration of how the pen itself works and what you would need to do to inject the medication. Remember that this is just a virtual demonstration, but that you can access any of our clinical practitioners at any time when you have joined the program to do this as a live demonstration to show you again. You start with the pen, and the pen is literally a pen, and you have a lid, you have a counter, and you have a dial, and you have a button at the end to press the medication through. What you do is you start by taking the lid off the pen, and inside it you have the liquid, which is the medication itself. Now, once the pen is on 0, you know that you're ready to go. This is a demonstration pen, and the first pen you'll get will be the low dose, that is of 0.25 milligrams to start with. You'll get 4 needles that look like this in the pen, and what you do is you start by ripping the paper on the back of the needle. You then put the needle onto the top of the pen and you screw it onto the top. Once it's screwed on tight, you take the white cap off the needle, and then you take the needle guard off the needle as well. And you're left with a small 4mm needle. When you've got the needle on and it's the first time you're using the pen, you have to prime the pen and make sure it's ready to work. So you have to do a test shot. For that, you dial from 0 to the 2 little dots with just a couple of turns. And what that then does is gives you the option to do a test shot where you press the white button at the end and you make sure that some medication comes out of the needle. This may take a couple of turns before there's enough medication to get through for you to be ready to dial to the full dose. So if you were to press it and you see some medication come through, that then tells you you are ready to do your dose. The counter will reset to 0, and what you then have to do is turn the dial all the way to the end, and it will take you to 0.25 milligrams, which is the starting dose. Once you've dialed to 0.25 and you can't go any further, you hold the pen a bit like a dagger. You then put your thumb on the white button, you lean back and you inject into any part of your abdomen, below and to the sides of your belly button. And once you're in, you press the white button until you cannot go any further and you hear a final click. Once you've done that, you count for 6 seconds before you pull the pen out. Once that's done, you take the white cap, you put that back on the needle, you unscrew the needle, you take the needle off the pen and put the covered needle in a yellow sharps bin, which you will be provided with as well. Once that's done, you put the lid of the pen back on the pen, and the pen usually lives in the door of your fridge until the following week when it's time for you to do your next injection again.